Nutrition care is a very important part of a patient's overall care, helping you to get through treatment and to recover more quickly. When eating and drinking as usual becomes difficult, a feeding tube can be an essential part of treatment by helping to maintain your nutrition and hydration. It can also keep you out of hospital and in the comfort of your own home. There's a whole team of people who are involved in your care, including doctors, nurses, dietitians and speech pathologists. We're all here to help you through your treatment and recovery.
If you're having trouble eating and drinking, then you might not be getting the nutrition and hydration you need. If that's the case, your care team may suggest that you have a gastrostomy tube inserted. One question we are often asked is, how will my gastrostomy tube be inserted? There are different ways of inserting a gastrostomy tube, and it's best to speak to your medical team about this. This video will focus on how to care for your gastrostomy once it has been inserted and how to give feeds and medications. A gastrostomy tube is a soft plastic tube that is fed into an opening in the skin and passed through to your stomach. The tube is held in place with a soft rubber disc or flange. The gastrostomy tube can easily sit under a person's clothing and is usually not noticeable. It's important that your gastrostomy tube and the skin around your tube stay clean. Here's what you can do to keep it clean and functioning well. Make sure that you have a daily shower. Take care to wash with soap and water under the round, soft rubber flange. Rotate the rubber flange daily so that you don't put uncomfortable pressure on your skin. You should flush the tube with around 50 millilitres of tap water once a day when it's not being used to deliver nutrition. If there is redness and/or some discharge on your skin, there may be an infection. Ask your nurse to take a look at it to provide advice on clearing the infection. Most infections get better quickly. If your gastrostomy tube falls out, do not use it. Call your medical team or the nearest hospital. It will need to be replaced as soon as possible because the hole in your tummy will begin to close.
While you are having your treatment and recovering, your dietitian will advise you of your nutritional needs. It is important to try and maintain your weight during and after treatment. You will be prescribed a liquid formula to give your body all its nutritional needs and enough water to keep you hydrated. It's important to not change the amount of formula and water prescribed for you. The two most common feeding methods are bolus feeding and pump feeding. A bolus feed uses a syringe to give a prescribed amount of formula over approximately 10 to 15 minutes, usually 4 to 6 times each day. A water flush is often given before and after each bolus feed. Pump feeding is sometimes known as continuous or intermittent feeding, where formula is given over several hours. Water flushes are often given a number of times during feeding. Firstly, wash your hands. Assemble all equipment using a clean syringe. Then remove the plunger from the syringe. Uncap the gastrostomy tube and connect the tip of the syringe to the gastrostomy tube. Undo the clamp if your gastrostomy has one. Flush with water before giving the formula. Pour the formula in slowly. Flush with water after giving the formula. Remove the syringe. Recap the gastrostomy. Reclamp the gastrostomy tube. Your dietitian will tell you how much water to use. It should take approximately 10 to 15 minutes to give a feed. Here are some extra FAQs that we are often asked and you may find helpful. Avoid using the plunger on the syringe as forcing feeds in too quickly may make you feel uncomfortable. You can still eat with a gastrostomy tube unless your doctor or speech pathologist tells you it is unsafe. You should only put the prescribed nutritional formula, water or medications through the gastrostomy tube. If you require pump feeding, your dietitian will show you how.
Medicine should be in a liquid form if possible. If your medical team has told you that your medication can be crushed, make sure you crush them well and mix with water to make a soup-like mixture. Do not mix medicine with the feeding formula. Do not mix medicines together. Each medication should be given separately. It is important to flush your gastrostomy tube with 50 ml of tap water before and after each medication. Some medications can't be crushed. You should speak to your medical team if you're unsure how to handle your medications. Patients may experience problems, for example diarrhea, an upset stomach or constipation. These are usually not caused by the tube or the formula. Try to keep up with your prescribed formula and water. Speak to your medical team about any problems you're experiencing so they can help you. Every patient is different. While we can't give you a specific time frame for when your gastrostomy tube will be removed, it is usually when you are eating and drinking enough by mouth to no longer need it. The procedure for removing the gastrostomy tube is quick and relatively pain-free. If you have any concerns or questions, you should discuss this with your medical team.
Overall, the experience wasn't as difficult as I thought it would be. I guess one of the first things was that I was quite surprised how early in the process the tube was put in. In fact, it was put in some time before I started my treatment, and I was kind of a little worried about that. But as the treatment progressed, it became obvious why that had happened, because if I'd have had to have it put in while I was under treatment, it would have been a much bigger issue and a much bigger deal for me. What I found when the tube was first put in was that for about a week it was a little sore. I was given some pretty explicit instructions by the nursing staff, who were throughout this whole process fantastic, and frankly after about a week the soreness went away, and to be honest it almost became something that I didn't think about from there on in. And in fact, with a little bit of organisation, I found that I could feed myself rather than having somebody do it for me. So you can become very self-sufficient. I guess one of my main concerns was twofold. One, how the tube would be put in, and secondly, how it would be taken out. The first part of that was quite easily dealt with. That was done as a procedure under anaesthetic. The second part to that question as to how it was taken out was a little more, I suppose, confronting when I asked, and that was that they would remove it just by pulling it out. And I suppose naturally I was a little concerned about that. I have to say that I needed to have no concern, and it all went very smoothly, and I might add, quite painlessly. From my perspective, the negatives, and there were not that many, are far outweighed by the positives of having the tube in place. The problem is that before you have it put in, you really don't know that, but with the benefit of hindsight, I can now say that. What I can also say is that the tube is an absolute godsend when you find that it's hard to swallow, and during the treatment that I underwent, that became the case 2 to 3 weeks into the treatment process. So to not have to stress around swallowing was just a real positive. For someone who's about to have the tube inserted, I would say that it really isn't a concern and very quickly becomes part of your body. And as such, you really don't think too much about it. In hindsight, it really wasn't as big an issue as I thought it was going to be.
Thank you for watching. Your treatment is being managed by a whole team of experts. If you have any questions at all about your care, please don't hesitate to ask any one of us.